Have you ever woken up in the middle of the night with that throbbing pain in your temples? Or perhaps you've been startled to see the numbers on your blood pressure monitor climbing higher and higher, while your doctor shakes their head with concern. I know exactly what it's like to live with that constant fear, checking your blood pressure several times a day, carrying medications everywhere, avoiding joyful moments with family because you're afraid that the emotion might make your heart work too hard. Hypertension steals more than our health. It steals our peace, our freedom. And the worst part is hearing those same generic recommendations. Cut the salt, lose weight, take your medications, as if it were that simple, right? After years of helping people like you regain control over their blood pressure, I've discovered solutions that your doctors rarely mention. Natural, accessible solutions that really work. In today's video, I'm going to share with you a simple 5-day protocol that has transformed the lives of hundreds of my patients. Imagine being able to gather with your grandchildren without worry, travel without fear of an emergency far from home, or simply wake up without that feeling of heaviness in your chest. This isn't just another empty promise. It's a proven path that you can start today with simple foods and habits that are already within your reach. So stay with me until the end, because this could be the most important video you'll watch this year for your cardiovascular health. Before we begin, I'd love to know if you or someone in your family suffers from high blood pressure. Leave a comment below sharing your experience or any questions you have about the topic. And don't forget to subscribe to the channel and turn on notifications to receive more content that can transform your health. Let me start by addressing the elephant in the room. When was the last time your doctor spent more than 5 minutes explaining exactly what happens in your body when your blood pressure rises? Most healthcare providers are overwhelmed with patient loads and simply don't have the time to give you the full picture. They prescribe medications, which absolutely have their place, but rarely explain how you can work with your own body's natural mechanisms to bring those numbers down. That's what we're focusing on today. A simple 5-day protocol that helps reset your body's pressure regulation systems naturally. The beauty of this approach is that it works alongside any medications you're currently taking. But many of my patients have found that with their doctor's supervision, they've been able to reduce their dependence on pharmaceuticals over time. So what exactly happens when your blood pressure rises? Inside your blood vessels, there's a delicate balance between constriction and relaxation. When this balance tips toward constriction, your heart has to work harder to pump blood through narrower passages, like trying to push water through a pinched garden hose. Over time, this added pressure damages the delicate lining of your blood vessels, creates inflammation, and forces your heart to work overtime. The 5-day protocol I'm sharing today targets the key systems involved in this process: your vascular flexibility, your kidneys' regulation of fluids, your adrenal gland stress response, and your body's natural inflammation levels. The cornerstone of this protocol is a powerful combination of 3 specific nutrients that work synergistically to relax blood vessels, reduce fluid retention, and fight the inflammation that makes your arteries less flexible. What's remarkable is that these nutrients are found in common foods that you probably already have in your kitchen right now. The key is knowing exactly how much to consume, when to consume them, and which combinations create the most powerful blood pressure lowering effect. I want to take a moment to ask something important. When was the last time someone really listened to your concerns about high blood pressure? Not just the numbers from your exam, but how you feel living with this condition day after day. Many people tell me privately how isolated they feel, as if no one really understands the constant weight they carry, that silent fear that accompanies every heartbeat. If you identify with this, I'd really like to hear your experience in the comments below. It can be something simple like, "I've been fighting hypertension for X years, and what afflicts me most is your biggest concern."
Sharing your story not only helps me create more relevant content for you, but also shows other people watching that they are not alone in this battle. Sometimes knowing that there is someone going through the same situation already brings immense relief. And who knows, your experience might be exactly what someone needed to read today to find hope. Now, let's continue with our conversation about how we can transform this reality together. Let's talk about the first cornerstone of our 5-day protocol: potassium. Did you know that the average American consumes only about half the recommended amount of potassium daily? This critical mineral works directly against sodium in your body's fluid balance systems. While sodium tends to hold fluid in your bloodstream, increasing pressure, potassium helps your body eliminate excess fluid through your kidneys. It's like having a natural diuretic without the side effects of medication. But that's not all. Potassium also helps relax the smooth muscle cells in your arterial walls, allowing them to widen and create more space for blood to flow. In studies where participants increased their potassium intake to the recommended 4,700 milligrams per day, researchers observed an average drop of 4 to 5 points in systolic pressure and 2 to 3 points in diastolic pressure. Now, you might be thinking of bananas when I mention potassium, but they're actually not the richest source. For our protocol, we'll focus on foods with even higher potassium content: white beans, spinach, sweet potatoes, and avocados. Just 1 cup of white beans contains nearly 1,200 milligrams, which is about 3 times what you'd get from a banana. During our 5-day reset, you'll be consuming strategically timed servings of these potassium powerhouses to maximize their blood pressure lowering effect. An important note: if you have kidney disease or are taking certain medications like ACE inhibitors or potassium-sparing diuretics, you should consult with your healthcare provider before significantly increasing your potassium intake. These conditions can affect how your body processes this mineral, and too much can be harmful. But for most people with normal kidney function, reaching the recommended daily amount is both safe and beneficial.
The second cornerstone of our protocol is magnesium, what I call the relaxation mineral. Magnesium plays a crucial role in over 300 enzymatic reactions in your body, including those that regulate blood vessel tone and heart rhythm. When your magnesium levels are optimal, your blood vessels can dilate more easily, reducing the resistance that your heart has to pump against. Additionally, magnesium helps regulate calcium flow in and out of cells, an important factor since calcium can cause blood vessels to constrict when it's not properly balanced. Clinical studies have shown that magnesium supplementation can reduce systolic blood pressure by an average of 3 to 4 points and diastolic pressure by about 2 points. Again, these might seem like small reductions, but the effects are more pronounced in people with existing hypertension and when combined with the other nutrients in our protocol. For our 5-day reset, we'll focus on magnesium-rich foods like dark leafy greens, especially spinach and Swiss chard, pumpkin seeds, dark chocolate with at least 70% cocoa content, and almonds. Just 1 ounce of pumpkin seeds provides about 156 milligrams of magnesium, nearly 40% of the daily recommended intake. During our 5-day reset, you'll be consuming specific combinations of these foods at strategic times to maximize their pressure-lowering effects. The third cornerstone is omega-3 fatty acids, particularly EPA and DHA, which are found primarily in fatty fish. These special fats have remarkable anti-inflammatory properties and help improve the elasticity of your blood vessels. They also reduce the production of compounds called oxylipins that cause vasoconstriction. In a meta-analysis of 70 clinical trials, researchers found that omega-3 supplementation reduced systolic pressure by an average of 1.5 points and diastolic pressure by about 1 point. Again, these might seem like modest reductions, but the effects are more pronounced in people with existing hypertension and when combined with the other nutrients in our protocol. For our 5-day reset, we'll focus on consuming wild-caught salmon, sardines, and mackerel. If you're vegetarian or vegan, we'll include plant sources like flax seeds and walnuts. Though it's important to note that these contain a form of omega-3 called ALA that your body must convert to EPA and DHA, and this conversion is not very efficient. 2 servings of fatty fish per week is the minimum recommendation. But during our intensive 5-day protocol, we'll include smaller portions more frequently to maintain steady levels of these beneficial fats in your system. Now, let's talk about the daily rhythm of our protocol. Each day follows a specific pattern designed to work with your body's natural cycles. We start each morning with a potassium-rich breakfast because your body is naturally in a state of mild dehydration after sleeping. This is why blood pressure readings are often highest in the morning. By immediately supplying your body with potassium, we help restore proper fluid balance right from the start of your day. Mid-morning, we focus on magnesium, which helps maintain the relaxation of your blood vessels during the busy, often stressful hours before lunch. Lunch combines all 3 of our cornerstone nutrients in specific proportions, providing sustained support during the afternoon hours when many people experience fatigue and stress that can elevate blood pressure. In the late afternoon, when many people experience a natural dip in energy and often reach for caffeine or sugar, both of which can raise blood pressure, we instead provide a strategic snack rich in magnesium and potassium that helps stabilize both energy and blood pressure. Dinner emphasizes omega-3s, which work during your sleep cycles to repair and reduce inflammation in your cardiovascular system. Finally, we include a special evening drink that contains a specific combination of compounds that help your blood vessels dilate and your body eliminate excess sodium while you sleep, the time when your body does most of its repair work. Let me break down exactly what each day looks like in our 5-day protocol. On day 1, we focus on resetting your taste buds and sodium balance. Most Americans have become accustomed to highly salted foods, which blunts our ability to taste and enjoy the natural flavors in fresh, whole foods. By dramatically reducing sodium while increasing potassium, we begin to restore this balance. Breakfast consists of a spinach and avocado smoothie with a small amount of berries for flavor. The specific ratio of spinach to avocado has been calibrated to provide optimal levels of both potassium and healthy fats that help your body absorb the fat-soluble nutrients. Mid-morning, you'll enjoy a small handful of pumpkin seeds and 2 squares of dark chocolate, a delicious combination that delivers a significant dose of magnesium. Lunch on day 1 includes a white bean salad with olive oil, lemon juice, and fresh herbs. The combination of beans, potassium, olive oil, monounsaturated fats that support blood vessel health, and lemon, vitamin C that helps improve the absorption of plant-based iron and support blood vessel integrity, creates a powerful synergy for blood pressure reduction. Your afternoon snack is a small apple with almond butter. The natural sugars provide energy while the almonds deliver magnesium and healthy fats that slow the absorption of those sugars, preventing blood sugar spikes that can stress your cardiovascular system. Dinner features wild-caught salmon with steamed sweet potatoes and a side of steamed Swiss chard. This meal delivers a powerful combination of omega-3s from the salmon, potassium from the sweet potatoes, and both potassium and magnesium from the Swiss chard. Finally, before bed, you'll drink a special tea made from hibiscus flowers, which have been shown in multiple studies to have a blood pressure lowering effect comparable to some medications. In one study, drinking hibiscus tea for just 6 weeks lowered systolic blood pressure by an average of 7.2 points. On day 2, we build on the foundation established on day 1, but introduce intermittent fasting, extending the period between dinner and breakfast to 14 hours. This fasting window triggers cellular repair processes that include improved blood vessel function. Don't worry, You won't feel hungry because dinner on day 1 is specifically designed to keep you satisfied through the night, and will start day 2 with a filling breakfast of overnight oats soaked with almond milk and topped with sliced bananas and a sprinkle of flax seeds. This combination provides sustained energy while delivering potassium, magnesium, and plant-based omega-3s.
Mid-morning on day 2, you'll enjoy a small handful of Brazil nuts. Just 2 or 3 are sufficient because they're extremely rich in selenium, a mineral that works synergistically with magnesium to support blood vessel health. Lunch features a colorful salad with quinoa, which provides both protein and magnesium, topped with pumpkin seeds, cherry tomatoes, cucumber, and a dressing made with olive oil and apple cider vinegar. The acetic acid in the vinegar has been shown to improve insulin sensitivity and reduce blood pressure when consumed regularly. Your afternoon snack on day 2 is particularly special. Celery sticks with almond butter. Celery contains compounds called phthalides that relax the muscles in and around the arterial walls, creating more space and allowing blood to flow more freely. When combined with the magnesium in almond butter, it's a simple but effective snack for mid-afternoon blood pressure support. Dinner includes mackerel, another rich source of omega-3s, served with roasted Brussels sprouts and a small baked potato with the skin on. The potato skin contains a significant amount of potassium. Your evening drink on day 2 is tart cherry juice diluted with water. The natural compounds in tart cherries support healthy sleep, and quality sleep is essential for blood pressure regulation. Day 3 of our protocol focuses on reducing inflammation throughout your cardiovascular system. Chronic low-grade inflammation is a major contributor to hypertension, causing arterial stiffness and reducing the production of nitric oxide, a molecule that helps blood vessels dilate. Breakfast consists of a bowl of berries rich in antioxidants that fight inflammation, topped with Greek yogurt, providing protein and calcium, and a sprinkle of chopped walnuts, offering plant-based omega-3s and additional anti-inflammatory compounds. Mid-morning, you'll enjoy a cup of green tea with a small square of dark chocolate. The catechins in green tea have been shown to improve blood vessel function and reduce inflammation, while the flavanols in dark chocolate support the production of nitric oxide. Together, they create a powerful synergy for cardiovascular health. Lunch on day 3 features a lentil soup rich in fiber, potassium, and magnesium, served with a small slice of whole grain bread drizzled with olive oil. The combination of soluble fiber from the lentils and monounsaturated fats from the olive oil helps reduce cholesterol absorption and support healthy blood pressure.
Your afternoon snack is a small orange with a few almonds. The vitamin C in the orange enhances iron absorption and supports collagen production in your blood vessels, while the almonds provide sustaining fats and magnesium. Dinner includes sardines, one of the richest sources of omega-3s, served over a bed of sautéed kale with garlic and a side of roasted butternut squash. Garlic contains compounds that help relax blood vessels and has been shown in numerous studies to reduce blood pressure when consumed regularly. Your evening drink is a calming chamomile tea with a sprinkle of cinnamon, which helps regulate blood sugar and has modest blood pressure lowering effects. Day 4 targets your body's stress response systems. Chronic stress is a major contributor to hypertension, causing your body to release hormones that constrict blood vessels and increase heart rate. Breakfast consists of a stress-reducing combination of steel-cut oats topped with blueberries and ground flax seeds. Steel-cut oats provide sustained energy without blood sugar spikes, while blueberries offer antioxidants that protect your blood vessels from the damaging effects of stress hormones. Mid-morning, you'll practice a simple breathing technique while enjoying a cup of tulsi tea, also known as holy basil. Tulsi is an adaptogenic herb that helps your body respond more effectively to stress and has been shown to moderately reduce blood pressure. Lunch features a colorful Buddha bowl with quinoa, roasted sweet potatoes, avocado, and a variety of raw vegetables, dressed with a tahini sauce. This meal provides a rainbow of antioxidants along with our cornerstone nutrients, potassium, magnesium, and healthy fats. Your afternoon snack on day 4 is particularly interesting: dark chocolate-covered pumpkin seeds. This delicious combination provides magnesium from both the chocolate and the seeds, along with zinc and other minerals that support your body's stress response systems. Dinner includes wild-caught trout, another excellent source of omega-3s, served with roasted asparagus and brown rice. Asparagus is a natural diuretic that helps your body eliminate excess sodium and water, while also providing folate, a B vitamin essential for controlling homocysteine levels. High homocysteine is associated with increased blood pressure and cardiovascular risk. Your evening drink is a small glass of tart cherry juice mixed with magnesium powder. This combination supports deep, restorative sleep, which is essential for blood pressure regulation. Day 5, our final day, brings together everything we've learned and practiced over the previous 4 days. Breakfast features a Mediterranean-inspired egg dish with spinach, tomatoes, olive oil, and a sprinkle of feta cheese. This combination provides protein, potassium, antioxidants, and healthy fats to start your day with stable energy and cardiovascular support. Mid-morning, you'll enjoy a small handful of mixed nuts, almonds, walnuts, and pistachios, each offering unique cardiovascular benefits. Pistachios, in particular, have been shown in clinical studies to reduce blood pressure due to their unique combination of antioxidants, healthy fats, and arginine, an amino acid that helps produce nitric oxide.
Lunch on our final day features a grain bowl with barley, which contains a unique fiber shown to reduce blood pressure, topped with lentils, roasted vegetables, avocado, and seeds. This meal provides a sustained release of energy along with a powerful dose of our cornerstone nutrients. Your afternoon snack is a small apple with almond butter, similar to day 1, but now your taste buds have adjusted to appreciate the natural sweetness of the apple without added sugars. Dinner on day 5 is a celebration of everything you've accomplished. It features a delicious salmon fillet crusted with crushed walnuts and herbs, served with a side of roasted purple potatoes and steamed broccoli. Purple potatoes contain unique antioxidants called anthocyanins that have been shown to reduce blood pressure, while broccoli provides sulforaphane, a compound that activates a protein called NRF2, which turns on antioxidant genes and protects your blood vessels from damage. Your final evening drink is a special blend of hibiscus and chamomile teas with a small amount of tart cherry juice, combining the benefits of all the evening drinks from the previous days. Now, what happens after these 5 days? Many of my patients report significant improvements in their blood pressure readings, often a reduction of 10 to 15 points in systolic pressure and 5 to 8 points in diastolic pressure. But the real magic happens when you incorporate these principles into your daily life beyond the initial reset. That's why I've developed a maintenance program that's less intensive but still provides powerful support for healthy blood pressure. The maintenance program involves continuing to emphasize our 3 cornerstone nutrients, potassium, magnesium, and omega-3s, while gradually reintroducing a wider variety of foods. We still focus on limiting sodium, but not as strictly as during the 5-day reset. The key is maintaining the ratio of potassium to sodium in your diet. Ideally, consuming about twice as much potassium as sodium each day. I want to emphasize that this dietary approach is powerful, but it works best as part of a comprehensive lifestyle approach to blood pressure management. Regular physical activity, even just walking 30 minutes a day, can reduce systolic blood pressure by an average of 4 to 9 points. Quality sleep, stress management techniques like meditation or deep breathing, and maintaining social connections all play important roles in regulating your cardiovascular system. And of course, if you're currently taking blood pressure medications, it's essential to work with your healthcare provider before making any changes. The natural approaches I've described often work synergistically with medications, sometimes allowing for reduced dosages over time, but this should always be done under professional supervision.
I've seen the transformation that happens when people take control of their blood pressure naturally. There's a special kind of confidence that comes from knowing you're supporting your body from the inside out,
not just masking symptoms with medications. My patients report more energy, better sleep, clearer thinking, and a renewed sense of optimism about their health future. Many are able to enjoy activities they'd given up out of fear, playing actively with grandchildren, traveling to places at high altitudes, or enjoying moderately intense exercise without constant worry. One question I often get is whether this approach works for everyone. The truth is that each person's body is unique, and there are genetic factors that influence how your body responds to dietary changes. However, in my clinical experience, about 85% of people with mild to moderate hypertension see significant improvements following this protocol. For those with severe hypertension, these dietary approaches typically work best alongside appropriate medication. Again, always working in partnership with your healthcare provider. Another common question concerns how quickly you'll see results. Some people notice changes in their blood pressure readings within the first 48 hours of the protocol, while for others, it takes the full 5 days or even a bit longer to see significant changes. This variation is normal and depends on factors like how long you've had hypertension, your starting blood pressure level, your body composition, and your individual metabolism. The key is consistency. The effects of these dietary changes build over time as your body heals and adapts. If you've made it this far, you probably know how difficult it is to live with uncontrolled blood pressure. That constant worry, the medications with side effects, the restrictions that seem to steal a little joy from everyday life. I want you to know that you're not alone on this journey. Our channel was born exactly from the desire to create a support community for people like you who are looking for natural and effective alternatives to care for cardiovascular health. Each week, we share new discoveries, simple recipes that help control pressure naturally, and answer questions that doctors often don't have time to explain during appointments. If this content made sense to you, consider subscribing to the channel and turning on notifications. This way, we can walk together on this health journey, one step at a time, without rushing, but with the consistency that your heart deserves. I don't promise miracles, but I guarantee honest information based on serious research and the experience of those who have already achieved real results. Take good care of yourself, and I hope to see you in the next video where we'll continue our conversation about how to live better even with hypertension. Your heart thanks you for every little care you dedicated to it today.
I believe that true health comes from understanding your body and working with it, not against it. The approach I've shared today is based on this philosophy, giving your body the specific nutrients it needs in the right amounts and combinations to regulate blood pressure naturally. It's not about quick fixes or miracle cures, but about sustainable changes that support your cardiovascular system for the long term. Remember, high blood pressure is not inevitable as you age. It's largely influenced by dietary and lifestyle factors that are within your control. By implementing the strategies we've discussed today, you're taking an active role in writing your own health story, one where hypertension doesn't have to be the main character. Thank you for staying with me through this detailed explanation of my 5-day blood pressure reset protocol. I'm excited for you to try it and experience the benefits for yourself. If you have any questions about implementing this approach, please leave them in the comments below, and I'll do my best to respond to as many as I can. And if you found this information valuable, please share it with friends or family members who might benefit. You could literally be helping to save someone's life.